We're sitting down today with Jessica, a manager in the mental health department at Children's Minnesota, and learning more about the services that they have to offer and what we can do to help in the community. Tell us more about Children's Minnesota and your mission.
So our mission at Children's is to meet the healthcare needs for kids before they're even born, all the way up through young adulthood, and meet the needs of all kids as well as service their families and make sure their families are really taken care of as well while their kids are getting healthcare.
What type of care is done here at the facility?
So we specialize in the pediatric population. We're one of the largest pediatric healthcare systems in the country, and we have over 60 pediatric specialties here.
How many families seek funding each year?
As a nonprofit organization, we don't turn any families away based on their ability to pay.
What is patient experience like, and what do you do to make sure it is unique?
So one of the things that we do is provide all kinds of different extra services to make it as comfortable for kids here as possible. It's very hard for kids to be in the hospital and be away from their families. So we offer services like child life specialists. We have music therapists that work with the kids, as well as art therapy. And we also have a child life zone. That's a place where patients and their families can interact and play so that they can feel a little bit at home here.
So you're located here in Minnesota. Do you see children outside of Minnesota?
We see kids across the region.
What type of impact do donations have on patients?
Donations actually have a huge impact on our patients while they're in the hospital. Regardless of the type of donation, if they're gifts from the community, it helps the kids know that people are thinking about them outside in the community and really care about them. And when they're in the hospital, it's nice to receive something special from someone.
In the last few years, our mental health crisis has increased greatly. How have you seen it affect our youth?
So at Children's, we've seen a pretty dramatic increase in the number of patients that need mental health services. And so we are really committed to expanding our mental health programs to meet the needs of the kids in the community and help support kids and get them the type of mental health care that they need.
What do you do as a facility to help children who are in need of mental health services?
So we have had psychology, outpatient psychology services, as well as psychiatry services, and we've also implemented having mental health therapists in our primary care clinics, just to have them embedded within those clinics to provide mental health support when it's needed. In addition to those services, we are focusing on expanding our inpatient mental health services by opening an inpatient mental health unit, and we also are offering day program services for kids that need mental health programming during the day and might need care that's more than just once a week therapy.
How can we as a community make a difference?
So like I mentioned earlier, the donations, big or small, make a big difference to the kids in the hospital. It helps them feel like they're cared for. But we can continue to support each other as a community by really talking about mental health and supporting one another and helping each other out when it's needed.